Healthcare Supply Chain. I'm Dana Trampus, your host. Each episode is a new chapter in the exploration of best practices, innovations, and advancements, ensuring that at the end of the healthcare supply chain, we prioritize the most vital element, human life. And understanding the people behind each link in the healthcare supply chain is crucial, which is why I'm incredibly excited for our guest here today. Can you introduce yourself and tell us a little bit about yourself?
Yeah, hi. My name is Ron Johnson, and I'm the Vice President of Innovation and Research and the Chief Operating Officer with Newfoundland Labrador Health Services. I've worked in the healthcare system now for about 30 years and had many roles, many roles, including the Director of Supply Chain. So I've had a background in this space and understand the importance. And it's a piece of the puzzle in delivering healthcare and a very important piece.
How does one get in the supply chain? Like, what was your path into healthcare supply chain? Was it linear? How did you get introduced into this world?
That's an interesting question. It wasn't linear. So my background is biomedical engineering, believe it or not. So I was in a technical role, looking after a medical technology life cycle, and I got into a lot of procurement in purchasing, specifications, needs assessments, health technology assessments. I was doing a lot of that, and it just naturally led myself into managing the whole supply chain, not just the capital side, but I moved into other roles, managing commodities and then services, and it just grew. So it was actually a very good career path for me. It allowed me to actually move to where I am today and into an executive role. It was one of my paths. One of my first director jobs was to become director of supply chain.
And as a chief operating officer at a provincial health system, what are some unique challenges and opportunities that you face in managing your health system? What is something unique that you get insight into?
Yeah, it is a different time. Like I said, I've had 30 years in the healthcare system, and this is probably one of the most unique times I've ever seen coming post-COVID. So we have an interesting issue with health human resources. We're challenged right now with having proper resources to provide services throughout the province. We have a lot of irons in the fire to address those challenges, but that is unique, especially in Newfoundland. I never thought in my time of being a Newfoundlander that we wouldn't have enough workers. It
Mm.
was always the opposite. Newfoundlanders left to go somewhere else to work. But it's unique. We don't have enough workers in this province, not only in health and in most fields. So that's causing a unique challenge. We have technology issues, that we need to address as well. And of course, again, the fast and shifting patterns of technology that can assist in this, there's lots of solutions to address the challenges. But I would say the most unique challenge now that we're facing is around the health human resources, no question.
And how are you kind of trying to mitigate those challenges? What has been helpful, or if we're missing something, what do we need to overcome the workforce shortage?
Well, what we've been doing, there's a big focus obviously on recruitment, right? And we've been doing a lot of that all over the world, really. But really, we need to stop people from leaving. So we have retention is the key, right? So we've been putting a lot of focus into retention. We've created a special department within our organization around retention, and that really involves simulation and training. How do we engage people into their jobs? And that's what we've been trying to do to address the health human resources. Productivity is also an issue as well that's related there. We're starting to think about how we can make the workforce as productive as it used to be, right? Like we see shifting patterns in practice that there's productivity shifts, and we're trying to understand that and trying to address it.
How do we get people to care about supply chain, especially the workforce and in healthcare? I think often, sometimes we don't realize or make that connection about how much that truly impacts, for example, the clinical bedside. Can you talk a little bit about that? Like, how do you get people to care about healthcare supply chain?
Well, I think that COVID really drove people to understand what happens when there's not resilience in the supply chain, right? So I really think that supply chain has moved from, basically the basement, the shop floor to the top floor, right? It has, you know what I mean? Like supply chain now is seen as a very strategic lever in an organization. Even this week in our own organization, as we're looking at efficiencies, the first place you go to two places, right? You go to supply chain and you go to IT. And it's seen as a strategic lever. And obviously, the things that you can do in that space right now to address health human resources, to address efficiencies, those levers are available. And I think that, I know in our organization, it is seen as strategic.
So you mentioned supply chain resilience. How do you define that in the context of a provincial health system? Is it different? Let's define that.
Well, to me, supply chain resilience basically means it has the ability to allow continuity in the face of ebbs and flows problems, right? And we see it every day. Drug shortages is big. We've seen it in COVID. And not only in COVID, we see it now where specialty products, and when there's wars and there's tornadoes and there's floods and there's famines, we see this on a continuous basis, and it's hitting home on a personal level. Like, during COVID, any type of project, if you're involved, if you're building a deck or a house, or if you went to the grocery store, it was things you noticed you couldn't get. And you amplify that into a workplace like a hospital. I mean, right now you can't, the way healthcare is, it's three elements, right? It's people, there's process, and there's technology. And
Technology isn't first too, right? So I think that the tech comes first. I think that's a valid point.
yeah, and so it's people see that, if you don't have the things at your fingertips to do the work, it causes frustration. It contributes to your retention problem. So an investment in strategic supply chain resilience is really an investment into yourself, a good investment.
So I know we hit on the people part, talked a little bit about the process. Let's talk about the tech part. I know I can't have a healthcare or technology conversation without somebody saying something about AI. I think it's just kind of infiltrated every space of conversation. But in that degree, what role does tech have in supporting supply chain resilience? Is there a place for AI in there? What do you think?
No question. I mean, the power of technology now in making a supply chain resilient, it's really, we're there. The technology is there. I think that AI will contribute to visibility. It can automate functions now that are manual. It can trigger alerts and alarms, and it'll give you all the things that you need. That really now is a manual function in a lot of ways. Even with technology that you have, it's still sometimes you got to go in and look for it. So I think AI will revolutionize supply chain really from all aspects of it, right? All aspects, inventory management, procurement. It will manage, environmental. It'll manage most aspects of supply chain. Again, it's not gonna remove the humans. It's a tool like a calculator,
Yeah.
right? Supply chain professionals, say 40 years ago, probably they did a lot of work by hand, right? They would have added and subtracted and count. But you very seldom that would happen now. People use this is going to be like the calculator on steroids. It's a tool. You
Yeah.
need humans to operate it and interpret it, but it'll become, my guess, within a number of years, it'll become like the calculator.
It'll become second nature. It's just another tool that we as the workforce can use to do our job to the best of our abilities. What other opportunities or innovations do you see in supply chain management? Like, is there some low-hanging fruit that we kind of should start looking towards?
We've been really shifting our strategies here in Newfoundland from aggregation to value, right? Like we've been trying to shift our thinking around supply chain and supply management to getting value out of it, not necessarily aggregation or lowest cost, right? And that there's a shift in mindset. So It's getting the products that will deliver the highest and best outcomes for our patients. And that's how we're looking.
So you mentioned the word strategy. How do you see the role of the supply chain management strategy evolving over, let's say, the next decade? Where are we going to start to see those shifts?
I think you're going to see those shifts fairly quickly. Uh, there's a bunch of factors, especially in healthcare. There's a bunch of factors that play in the Canadian context. Most Canadian healthcare systems now have or are about to replace their healthcare information systems. That's happening here in Newfoundland or in the throes of it right now. With that, with these modern systems, you're going to be able to actually manage supply chain like a grocery store, right? You can't do that now. Can't do that now in healthcare because we don't have the systems and the technologies. But the new systems will have integration with suppliers, integrated systems connected. They will have likely all kinds of insight into the analytics of how you're using, and also linked to the patient record to understand how these supplies impact care, right? From a quality and safety perspective. So the Canadian marketplace is really at a change point, a pivot point where the technology is now catching up to modern technology, so that you're going to see rapid advances in healthcare supply chain to mimic other industries that are currently ahead of us. We're getting there. And I think that is going to make a resilient supply chain, because right now, most of these systems in a Canadian context are manual, a lot of them. This now, the technologies will allow automate. And once it's automated, you'll bring resilience and you'll bring efficiency. And that's, I think we're really set up in the Canadian context. And in the next couple of years, you'll see this take off.
One thing about Canada that is a big piece is that you do have some rural areas that may be hard to reach. Here I'm in the Midwest of the US. We have some very rural areas that can be hard to reach. So how do we reach them? And how do you engage with that community to address supply chain challenges and needs?
You got to think out of the box, okay? Like, I don't know if you know Newfoundland, Labrador, but Newfoundland, Labrador is a unique province. We were the last province to join Canada in 1949, so there's some nuances with that. We have 500,000 people. That's it. But the land mass is bigger than Texas, okay? 300,000 of those 500,000 live in one area of the province, and the other 200,000 live everywhere else. So we understand the unique challenges of geography because we're dealing with it. So what you have to do, I think, is think out of the box. I'll give you an example. 3D print is a beautiful way to service rural areas, especially for specialty items. If you need an umbilical cord clip and you're up in Maine, Labrador, and you only use one or two in a year, you don't need to buy a box of 1,000. You could actually go in and we have a central repository of 3D print items that are in a catalog, and the 3D printer is in Maine. They go grab the item and print it out locally. So these are different ways to get at this, right? I mean, obviously there's traditional ways, but I do think having technology and insight into these areas, into the rural areas and linkages will help. But thinking out of the box, really. And I think new technologies are allowing it.
I think we're at the point where we're going to start wrapping up a little bit. So I think I have one more question for you is, where do we go from here? How do we advance supply chain resilience? What is the next step? And how do we get people to do it? How do we motivate people to advance supply chain?
I think, like we're doing that now by awareness is probably our biggest, our biggest. I think, the awareness and then, working with our political leaders to understand the impacts of what this has. And we're just coming out of COVID. This is fresh in people's minds. We have a short window, though, very short window, because, I remember when we had H1N1. And we did all kinds of things, and that wasn't the real, that was a mini COVID. But we quickly reverted back. We forgot about what happened. And now COVID is still around us a little. Uh, we will forget about that too. Uh, we have a short window here now to develop these systems to be resilient so we don't have another COVID. Who would want to see what happened there again? Because, supply chain was a contributor to some of those issues. So I do think while it's fresh in people's minds now, we need to strike. And I do think it's in some cases it's investment of money, and in Canada from a publicly funded health system, it's funded through the government. So we need the political apparatus behind us.
I think you bring up a great point. We need political support and we need the funding that will help kind of catapult supply chain forward. I want to thank you for your time today, Ron. If anybody wanted to learn more about you or your work, are you active on social media? How could people get in touch with you if they wanted to learn more?
I'm active on LinkedIn if they can get me there, and also they could email me. I could give you my email. That's okay. That's fine too.
Great.
The email is ron.johnson@nlhealthservices.ca.
Well, thank you for joining us today for Scan Health Can. If you liked today's conversation, please like, share, and subscribe. We'll see you next time. I'm Dana Trampus, your host.